What up? I decided to lighten the mood for this video because it's going to be talking about things that, confusing things that I've been dealing with. Okay, so I just got back from my gender psychiatrist this week. He's the guy I've been waiting to see that basically has, he's the one who makes the top surgery thing happen. He's the one who talks to me, makes sure that I'm sane, and so on and so forth. So now I was approved for top surgery, which is fantastic. But the whole meeting itself was really confusing, and I really struggled to feel comfortable answering some questions, not due to gender dysphoria, but just to my own personal beliefs with like binaries and such. A lot of questions were targeted at like, do you feel more male? Do you feel more female? Like when you dream, are you male? And it made me feel really confused, and I just didn't really know how to answer it because I explained to him that, you know, I was genderqueer and that even I don't really like using that term. If I could go without it, I would. I'm somebody who feels both masculine and feminine, and I embrace both sides, and that's pretty much it. And I was really scared that I wouldn't be able to get top surgery because I wasn't fully transgendered. I really felt like he pushed me into testosterone the whole time we were talking. I know he has to ask those questions, some of the questions, but just some of his answers were more like, you know, if you do decide to go on testosterone, or like down the road when, you know, testosterone may be an option for you, like it was like just like kind of like maybe right now you're feeling genderqueer, but maybe later down the road you're going to be transgendered, and like, you know, try going on testosterone for a month and see like how you feel, because I can guarantee all your anxieties will go away and such. So I didn't really know how to respond to that because it got really in my head, and then I was like, wait a minute, no, I'm not trans. And so I, you know, explained to him, you know, like I know that I was not born a man. I don't feel that way. I just want to be comfortable and happy, and I think the only way I can really feel happy and comfortable in my day-to-day life is by, you know, not exactly having something here. You know, if I could stop estrogen and not have testosterone, I would be living in a perfect world, but unfortunately it doesn't work like that. So I have to learn to love a part of me in some way, which I'm really trying to do. I'm trying to embrace who I am as a person, and you know, just learn to love myself as much as I possibly can, and, you know, just accept some things aren't just gonna have to be that way, unfortunately. So yeah, now I'm waiting to get surgery. I'm pretty excited. I'm pretty nervous. Like I said, I've been feeling really confused since that meeting, just because we talked about a lot of my personal life, a lot of things I had never talked about before, and opened a lot of doors quickly, and it kind of just left me like thinking all day on the bus, and just like about my life and my choices and where I'm going to be down the road. And then I realized, you know, like I need to stop worrying so much about the future, just like live in the now, and just, you know, go off what I'm feeling now, because, you know, I can't picture what, like, he asked me, like, well, are you gonna, when you picture yourself as an old person, is it an old man or an old woman? Well, it's like, I don't even want to think that far ahead of my life. Like, you know, if that decision comes down the road where I feel like I need to be a man, you know, like that will be that choice. But right now in my life, like, I am happy to embrace both masculine and feminine qualities. I'm a human being that feels both, and, you know, that's as much as I can say. So yeah, I'm really excited about getting surgery, and, you know, getting to know myself more throughout this time that I have to wait as well. But yeah, it was super strange that I was getting pushed to go on testosterone. Yeah, that's not how I feel inside. I do know that the Alberta government makes money off of it, so I had a feeling that I was kind of getting pushed into it too, for money's sake, which would suck. But yeah, no, So that's an update. If you live in Alberta, there are 2 gender psychiatrists. There's quite a long wait. I waited since May of last year to get in to see Dr. Raish. He was trained up in Edmonton, and now he's in Calgary, taking on all the clients down here, because apparently there's quite a bit. So Dr. Raish is the person you would see. He's in the South Tower at the Foothills Hospital on the 7th floor. Yeah. So if you're in that same boat, I'm here. You can always talk to me if you need support. It's out there. And he kind of explained to me, gender dysphoria, it's all seen the same way. If you're feeling about your body that way, they're not going to tell me what to feel necessarily, and he's not going to decline my top surgery purely on being genderqueer, but they base it on the amount of gender dysphoria, which is fantastic that Canada is so rad. Well, I guess the Alberta government is so rad to recognize gender dysphoria versus your gender. I do have a letter now for being able to pee in the bathroom for the men's room, but it says that I'm trans and I'm a man and to treat me no different than a man, which I just am accepting. I know I may, there's times where I really don't feel comfortable using the women's room. I do use the women's room, but there are some places where I just don't necessarily feel like that's where I want to go to the bathroom. So, that's purely why I have that letter. It just sucks that it says that I'm trans. I guess that's how it has to be. And there's one more thing that I got. Oh yeah, I'm getting a buttload of tests done today. I haven't been able to eat for 8 hours. I'm getting my glucose levels checked. I'm getting all my hormone levels checked. My testosterone, my progesterone, a couple other ones that attribute to ovary and pregnancy, I guess. I'm getting a urea test, which is a breathing test, and 7 other freaking blood tests. So I'm getting the same treatment as a trans person would, as before they go on T. They're basically making sure I'm able to go on T if I ever wanted to. But I think it's really good to find out about all these things anyways. So yeah, I'm gonna go do that in a couple hours here. And sorry that this video might be a little bit boring. But yeah, so if you're feeling like you want to get top surgery, or you want to start testosterone, Dr. Raish is the man you want to see. He was really nice. He was very good. I really enjoyed our session as much as I was confused by, what he's had to basically be taught to ask. Can't blame him though. Anyways, if you have any questions, you can always message me. Anything else, I'm always here. Got my support. Peace out.